Hey, you're here with NovaCare Sports Medicine. My name is Joel Roth, physical therapist, and today we're going to discuss the early phases of rehab following an ACL reconstruction. Early on, we want to make sure we educate our patients. We want to look out for any red flags that may be an indication of infection or thrombosis. And we want to educate our patients on the principle POLICE. What is POLICE? It stands for P, protect the graft. We want to pay attention to any precautions that the surgeon may have given you, weight-bearing restrictions and range of motion restrictions. OL, we want to focus on optimizing loading. We do that through range of motion and strengthening exercises. And ICE, ice compression elevation, in order to decrease any pain and inflammation. So today we're going to talk more specifically about neuromuscular electrical stimulation, or NMES. NMES is used to combat post-op quad inhibition, which is a common concern, especially following an ACL reconstruction. All right, so we're going to initiate it with the use of a quad set. We do this to promote quad activation. Eventually, he'll progress to doing it with a straight leg raise in order to address any possible quadriceps lag. He'll eventually progress to doing it with an isometric. And we use this to strengthen the quad at different ranges of motion. And as he progresses through his protocol early on, and he's released to do full weight bearing, he's going to progress to doing some closed chain exercises, more functional exercises. So we can use a TKE, add a little resistance with the band. And then eventually, to promote knee control, we can use it with a step down. The use of NMES early in rehab has been shown to improve quad function and outcomes up to 3 months post-op compared to those who did not use NMES. The parameters may change depending on what exercises we're going to be using it with. And an elite athlete would be doing this at minimum twice a day under the supervision of an athletic trainer or a physical therapist to ensure that we are appropriately aggressive as we progress through these exercises. So tune in next week as we continue to talk about the early phase of rehab, and we're going to do a focus on blood flow restriction therapy.